Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, why CMS is shifting its infection control focus to sepsis. Quality experts at CMS will be taking a closer look at sepsis rates in nursing homes while continuing broader efforts to improve infection control, leaders said Wednesday, stating readmissions and per-QIN QIOs, the most common reason for readmission is typically related to sepsis. QI organizations already support nursing homes looking for additional resources, and CMS is working with the CDC and Sepsis Alliance to develop more education on best practices for preventing, recognizing, and treating sepsis. In nursing homes, the focus is on making sure staff is well trained to identify early sepsis before it progresses, as it can be a runaway train if not stopped early. Nursing homes should work with family members to explain sepsis, a bloodstream infection caused by bacteria, since family are usually involved in care or visiting frequently and may be the first to notice changes in residents' conditions. Another way of lowering sepsis rates, already tracked by CMS, would be to do a better job of preventing other, more localized infections such as UTIs. While CMS has not moved to add a sepsis metric to its expanding VBP plans, research efforts at this early stage could later inform initiatives and incentives. The HHS Office of the Inspector General is expected to issue audit findings this year on potentially preventable hospitalizations of Medicare-eligible skilled nursing residents, including those who need acute care for UTIs, sepsis, and 4 other conditions. The prior OIG work identified SNFs often did not provide UTI prevention and detection services per its residents' care plans, increasing the residents' risk for infection and hospitalization. The OIG has also kept broader pressure on the nursing home infection control standards and capabilities. Last month, CMS announced it would enact EBP requirements for nursing homes where residents have active MDRO infections or are known carriers. But nursing home leaders have raised concerns that more routine use of gloves and gowns, even around residents not actively infected, would take away from a nursing facility's home-like feel, increase costs, and take up valuable staff time. The March 20th QSO memo was intended to give a very clear and concise guidance to both surveyors and nursing home frontline staff. The rules went into effect April 1st, leaving nursing homes some discretion as to where and when they use additional PPE in residents with MDROs not targeted by the CDC. How will this impact nursing homes? How will we keep the home in nursing homes? Next, the alleged DNR mix-up death highlights concerns for nursing homes. The untimely death of a Connecticut nursing home resident in September was the result of a mistakenly applied roommate's DNR order, alleges a lawsuit filed by the resident's daughter last week. The potential mix-up illuminates struggles faced by nursing homes across the country when it comes to managing increasingly complex needs of residents. The negligence suit was filed against the Reservoir Nursing Home in West Hartford, Connecticut, its acting nurse supervisor, and the nursing home's operator, Harborside Connecticut Limited Partnership. The resident was found unresponsive on September 4th, and staff were allegedly told not to perform CPR, according to the lawsuit. Staff did call 911, and when the facility leadership could not provide DNR documentation, first responders performed CPR, ultimately unsuccessfully. Allegedly, the DNR eventually was provided and applied to her roommate. Lawyers representing the plaintiff expressed being puzzled at the apparent lack of protocols or the failure to follow existing protocols indicated by the events alleged in the lawsuit. CMS has implemented ample guidance governing how facilities should create protocols for DNRs and administering CPR. The Connecticut Department of Health issued Harborside a $10,000 citation for the incident. Reservoir is now operating under a new name and owned by another company. While headline-grabbing, DNR mix-ups are not a common occurrence in nursing homes. Still, the potential for harm to residents and heavy penalties for providers, including potential for IJ citations and investigations by health departments, mean regularly reviewing the status of DNRs, and it should be a routine practice. Mix-up where a resident is mistakenly resuscitated or, as would allegedly have been in the case at the Reservoir, not resuscitated despite wishes, are usually the result of one of 2 common mistakes. Either staff do not follow facility policy, identifying a resident DNR status at the time the resident is found unresponsive, or the facility does not have sound protocol to follow with clear directives as to the location of the resident's DNR status information. This info must be verified at the time of a medical emergency, before CPR is started. Some nursing homes use visual cues like wristbands with colored dots to signify whether a resident has a DNR on record. These methods can be unreliable and should never be the sole factor relied on in emergencies. Even medical orders can be incorrect if they haven't been updated properly. The best source is resident medical records where the advance directive documents are located. Auditing and running drills regularly are vital to maintaining accuracy and should be a common routine for providers looking to avoid fines or harmful care outcomes. Senators, update Medicare to help beneficiaries with chronic conditions. Medicare must evolve to better support seniors with chronic conditions. Physician pay reform and value-based care are important pieces to achieving that, senators offered during a Finance Committee meeting last Thursday. Traditional Medicare is falling behind when it comes to helping seniors manage their health when living with multiple chronic conditions, because it is no longer only an acute care program. Medicare spending today is dominated by chronic conditions, and seniors need special services to help them live comfortably and healthily. But traditional Medicare does not have enough flexibility to provide the right kinds of care. The first step solving this issue is providing better support for physicians who deliver primary care on the front lines. The challenge is to improve the way Medicare pays for services delivered in the doctor's office, at home, and with laser focus. Post-acute and hospice providers have historically been in support of robust physician payment policies, and in November 2023, the Society for Post-Acute and LTC Medicine and the American Academy of Hospice and Palliative Medicine both signed a letter urging Medicare to ensure physician pay keeps up with rising inflation service costs. Encouraging value-based care is another way to ensure seniors with chronic conditions can access the care needed. Structural fee schedule reform should shift away from the status quo, which forces clinicians to vie for ever-dwindling resources, moving towards models promoting and rewarding team-based, resident-centered approaches. Reforms to advance value-based care demand a focus not just on financial incentives, but also on structural improvements ensuring meaningful options informed by clinical experience and aligned with the residents' needs. The move towards value-based care has been an advantage for PCPs, who also stand to benefit from improved physician pay. Value-based entities have become increasingly active, which has helped beneficiaries better manage chronic conditions according to CMS. Traditional Medicare should be keeping up with the needs of beneficiaries, care coordination, non-medical determinants of health, and the like. And lastly, the House bill calls for $1.6 billion program to bolster nursing home workforce. A new U.S. House bill aims to bolster the country's nursing home workforce with $400 million over each of the next 4 years. The Nursing Home Workforce Support and Expansion Act would provide workforce grants to states, U.S. territories, and tribal governments based on their population of seniors and people with disabilities, targeting pay, benefits, education, and retention improvements for nursing home workers. Proposed legislation would provide wage subsidies to help keep nursing home wages competitive with other healthcare sectors and competing industries. To supplement, grants would fund student loan and tuition assistance, guarantee affordable childcare, and subsidize transportation costs for workers. Measures would be required of any government entity accepting grant funding. Additionally, government bodies would have discretion to use grant funding to create emergency funds for nursing homes, subsidize paid leave for care workers, and provide resources like interview clothes and legal assistance to lower the barriers of entry into the LTC workforce. The bill defines who qualifies as an eligible individual to receiving funding from the proposed grants, such as CNAs, LPNs, social workers, and anyone training for certifications in those roles. LTC workers face low wages and challenging work conditions. But the difference that high-quality care can make to residents makes this legislation and investing in care workers in nursing homes, skilled workers, very important, while also expanding the workforce by attracting new individuals to the field. Proposed legislation comes as LTC providers are awaiting the arrival of a first-ever national nursing home staffing mandate, an already existing staffing shortage during which nearly 250,000 nursing home workers left the sector between 2020 and 2023. Providers and policymakers critical of the staffing rule from CMS have frequently called it an unfunded mandate, clumsy, one-size-fits-all approach to improving care. Forecasts of total costs for providers to implement the rule vary, with CMS initially estimating around $4 billion and AHCA estimating a roughly 70% higher $6.8 billion. While proposed legislation would make up for only a portion of the suggested price tag, total of $1.6 billion spread between fiscal years 2025 to 2028 is expected. Top critics of the mandate have united behind the bill. The Nursing Home Workforce Support and Expansion Act exemplifies the support LTC and post-acute care profession needs as they continue to face caregiver shortages. Without staff, there is no care. The bill is one step closer to an America that values older adults and those who serve them. Thanks for joining News This Week in Nursing Homes. To get more Qsource news and info, visit Qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.